confirmed cases since the beginning of the pandemic. That is just 41 new cases since yesterday. There are, I'm sad to say, now 723 people who have died in Victoria because of this global pandemic. That's an increase of 7 since yesterday's report. 1 female and 1 male in their 70s, 1 female in their 80s, 4 females in their 90s. 6 of those 7 deaths are connected to aged care outbreaks. Again, we send our condolences and our sympathies to each and every one of those 7 families at what will be a very difficult time. There are 116 Victorians in hospital. That number continues to come down. 11 of those are in intensive care and 5 of those 11 are on a ventilator. A total of 2,488,773 test results have been received since the beginning of the year. That's an increase of 17,396 test results since yesterday. Can I again thank each and every one of those Victorians who came forward to get a test? And can I ask each and every Victorian who has even the mildest symptoms, please come forward and get tested. It's so important. It's a simple thing, but it makes a massive difference. In order to make really difficult decisions, finely balanced decisions about exactly how we deal with this enemy, how we have the best possible response, we have to have the clearest picture of how much virus is out there, where it is, how it's moving, trends and patterns. If you've got even the mildest of symptoms, as soon as those symptoms start, please come forward and get tested. We'll get your results back to you within 24 hours. 90% of those results are coming back within 24 hours, and you will have played an enormous part in our collective fight against this virus and our safe and steady steps towards a COVID normal and a normal Christmas and a summer like no other. It's such an important thing for you to do. In terms of cases of unknown source, 4,285, that's a decrease of 11 since yesterday. There are 176 healthcare workers who are active cases. We send them our best wishes and we thank them and all of their colleagues for the amazing job they do every hour of every day right across the state. There are 1,157 active cases in Victoria, so again those numbers continue to fall as well. In terms of the metro regional split, there are 52 cases in regional Victoria, active cases, in those local government areas that are under stage 3. No new cases in regional Victoria. There was a case reported from Horsham. I just want to take you through the details of that for the reassurance of people in the Horsham community and that district. The case reported was a person who's been in Melbourne for the past 4 months, is known to have acquired the virus in Melbourne and has not been in Horsham whilst infectious. The person's residential address is in that community, which is why the case has been recorded in that way. The case will have no impact on decisions informing when regional Victoria can take next steps, just for the avoidance of any doubt on that front. But those numbers in regional Victoria are low, they're getting lower, and that is, I hope, seen, well, it'll be very welcome in regional Victoria. I think we can be confident of that, but I hope that people in Melbourne are looking to what's occurring in regional Victoria as proof positive, not a model, not a theory, but the actual delivery of this plan. Our aim was always to get those numbers down, to keep them low, and then to be able to take those safe and steady steps. Today, I can announce that we have extended the state of emergency and the state of disaster for a further 4 weeks. That underpins all the different rules. It underpins taking those safe and steady steps. And of course, I'll come to what those steps mean, just to remind every Victorian about what those steps mean from midnight tonight. But regional Victoria will take 1 step today, and they will potentially, around the middle of the week, reach those thresholds of less than 5 cases, a 14-day average. They're at 4.1 cases now per day. It's a mighty job, and I'm very proud of every regional Victorian, and every Melburnian should look with hope and positivity to what's happening in regional Victoria as not a theoretical exercise, not an academic exercise, but a real live exercise. This strategy is working. This strategy is delivering low numbers and keeping them low, and it's at that point that you can open with real confidence that having got the numbers low, you can keep the numbers low. You can open up and stay open. That's what we want, and that's what we will deliver. That is what we will deliver in regional Victoria and right across metropolitan Melbourne. Not bouncing in and out of lockdowns, but making sure that everything that Victorians have given counts for something and delivers us, as I've said, a summer that will be like no other. It will be a very different end of this year, and 2021 will be a very different year than 2020 has been. That's our aim, and that's exactly what we'll deliver with the amazing help and support of every single Victorian. In terms of my usual updates in relation to aged care, there are 572 active cases in aged care facilities. In disability facility settings, I didn't give you this number yesterday, we just double-checked and triple-checked, in fact. It is 10 active cases in disability facility settings, 6 staff and 4 residents. And again, both in aged care, we've seen some stability come to that and a fall in the number of active cases. In those disability settings where there's a significant underlying challenge, a real vulnerability with many of those clients and residents, it's very pleasing to see not just stability but to see those numbers fall consistently